Okay, I think we'll get started. I'm Sonja Kahlmeier. I have the great pleasure of welcoming everybody to this session on the 10 years of experience and the look forward on the health economic assessment tool that I've had the pleasure of being involved with right from the start until today and also into the future. I'm the head of Department of Health of the Swiss Distance University of Applied Science here in Switzerland, and I'm moderating this session today. We will first hear a welcome from Francesca Racioppi on behalf of the WHO European Centre on Environment and Health, and then hear parts of the heat story from three different key experts who were involved in its development, and then we'll have a case study from Lucy Saunders from London and another one from Professor Kanerva-Lehto Heli from Finland, and then we have time for your questions and some final words. So without further ado, I'm handing over to Francesca Racioppi to welcome and open the session.
Many thanks to Sonja, and welcome everybody. It is late afternoon in Europe. For those of you who are connecting from other parts of the world, it might be still the morning. So a very warm welcome to this side event. We are here because in a few days from now, actually in a week from now, member states will gather virtually in Vienna to take bold steps towards a more sustainable transport. And they will do that, we expect, by adopting a ministerial declaration that sets out a vision. But including into that, we are also expecting them to adopt the first ever pan-European master plan for the promotion of cycling. And it is very important that we are able to hold this workshop today in that context, because this is the story that we are going to tell you. It's a story of how some incredible window of opportunities came up together when the science gave us the evidence that we needed to start bringing cycling and walking in quantitative terms into the equation of transport and urban planners. They have been looking and making decisions on transport models, on interventions, very often using cost-benefit analysis, economic arguments. As a public health practitioners, we felt it was very important to help them seeing cycling and walking. And there is no other way of seeing them unless we are able to measure them. So some 10, 15 years ago, we were very lucky because the science came up together. Finally, we were able to calculate what it means if we have people who start cycling and walking, meeting the so-called WHO guidelines for physical activity. How does that translate in quantitative terms, in terms of reduced mortality? How does that translate in terms of economic figures? And this has been the story about it. And this is what has kept us excited and what makes me feeling hugely privileged to be today to share a 10th birthday anniversary for the heat at such a special point in time. You will hear more about how the idea came about, how the application has been used, and also why at some point the member states thought that, yeah, it was a very good idea to try and invest into this tool. I hope you will enjoy this. I hope you will enjoy the journey, but more than everything, I hope that you will follow us in the next steps. We have two main ambitions here. One, we are working right on that. We see the opportunity of taking the heat on a global platform. There is a need for that at this time when active mobility is growing in prominence across the world. And we want to make the heat available to those member states who will be actively engaged in implementing the master plan on cycling. We hope that it will be a daily tool for them to support their decisions, and we look forward to working with all of you and to be in touch with you on how we can make this tool something useful and good for all of you. So it is my privilege to be today with some of the people who have made the history of the heat, some of the people who have been the strongest advocate for this work, and I'm giving the floor back now to Sonja to continue with the next part of the presentation. Thanks again, everybody, for being with us today, but throughout the journey.
Thank you very much, Francesca, for these introductory words. I'm handing over to Professor Harry Rutter from the University of Bath to tell us about the birth of this idea.
Thanks very much, Sonja. Can you see my screen? Can you see a slide, an introductory slide?
Yes.
Because the screen share is quite confusing on here. Thanks very much, and thank you for that introduction, and absolutely delighted to be here. I'm just here to spend 5 minutes or so talking about how this all started. And I guess the very beginning of this was this book. I don't know if you can see me as well, but I'm waving it at you. Written in 1992 by someone called Mayer Hillman for the British Medical Association, in which he really was the first person to do some meaningful calculations around the costs and benefits of cycling. He then published a paper in Policy Studies the following year, in which he stated that the benefits gained from regular cycling outweigh the loss of life years in fatalities by a factor of around 20 to 1. The trouble was that Mayer, brilliant though he is, hadn't actually shown his working and hadn't shown the underpinnings of these calculations. There are pages of calculations at the end of the book, but it wasn't clear exactly what had been done to arrive at this this figure of a 20 to 1 ratio of the benefits as opposed to the costs from regular cycling. A few years after that, 1999-2000, I was doing my master's degree, and I decided for my project, my master's project, my dissertation, to look at this calculation that Mayer Hillman had done. And we had to couch it in terms of one's local area. So I did it for Oxfordshire, which is where I live, and as well as nationally. And one of the things I did was to calculate the reduction in relative risk of death for people engaging in regular cycling, based on not cycling, but just what we know about the health benefits of physical activity in general. This chart was actually an adaptation of a chart from Paffenbarger's study, Harvard alumni study. And basically what it showed is that within the kind of typical range of a daily commute of maybe 20 minutes in each direction, somewhere around here, people who engaged in that level of cycling would reduce their relative risk of death by around a third, something around a third, compared to people who were sedentary. And what I was then able to do was, because of the reductions in coronary heart disease, relate that to the expected deaths within a population. This was looking at Oxfordshire, a county in England, and for different proportions of the population taking up cycling, what that would mean in terms of life years gained as opposed to those lost. Compared, and the figures lost were from the measures of people who had died on the roads as cyclists in the county. And what we found was that for different ranges, the ratio went from 7 to 1 up to 151. So if a quarter of the population started cycling regularly, potentially there would be a massive gain due to increased cycling. So this was all rather a crude little master's project, but I was lucky enough to be able to present it at a conference in Glasgow, and I was even luckier that Francesca was at that conference. And it turned out that this work was related to something that she had been thinking about for a while. She then invited me to a WHO meeting that was held shortly afterwards, where, among other people, Lars Bo Andersen were present, and Lars Bo presented a paper from the Copenhagen Heart Study that was subsequently published in this paper in 2000, that was a better figure than the one that I'd used in my report, and looked at all-cause mortality rather than just reductions in coronary heart deaths from coronary heart disease. And there was a small group of us who were churning these ideas around. The small group that is largely present on this call, actually. So Sonja and Nick and Francesca and a few others. And we were churning these ideas around, trying to think, how do we get this to work? How do we turn this from being something that seems like a reasonable way of calculating the potential benefits of active travel into something that is meaningful to transport planners, transport decision makers, transport economists. And one of the principles we alighted upon was this idea of stepping into other people's shoes. And all too often in public health, what we tend to do is shout louder and louder about the things that we believe to be right. But we tried to do something different with this tool. What we tried to do was find out what it was that transport decision makers needed to inform their decision making, and see the ways in which we could bring public health thinking to bear to their decision-making process. And eventually, after many years, we got some, I assume it was support from the Austrian government, and we held a meeting in Graz. If it had been in recent times, of course, we'd have endless selfies on our mobile phones. But Nick and I have both been through our old photos. Neither of us could find any pictures of it. But I have a feeling that it was the, oh gosh, what was it called? Park Hotel, something like that in Graz. Anyway, I found a picture on the hotel website. I think this may be the room that we met in. I think it may be called Elizabeth. And there was a group of, I don't know, maybe Francesca or Sonja or Nick can correct me, maybe 20 people who were bringing in their expertise. And we were scratching our heads thinking, how do we do this sort of bottom-up calculation where we don't get double counting from looking at obesity and heart disease and all the other different benefits that we might look at? And while all this was going on, we had a kind of a sudden moment of realizing there was another way to think about this. There was another way to frame this challenge, which was that if transport economists have an approach that says we're going to estimate the one aspect of the estimation of the economics of transport decision making is to look at the impact of any transport scheme on deaths, and that might be deaths from injuries, that might be deaths from air pollution, whatever it might be, and a scheme might reduce those deaths, or conceivably it might increase those deaths. So the way they estimated the economic value of those deaths was through a statistical thing called statistical value of a life. And it's an economics tool for estimating within that kind of decision-making process the cost of the economy, the cost to the exchequer, a willingness to pay approach. It's a synthesis of a number of things to provide an estimate of the cost of a life within the decision-making process. And we just thought, how about if we flip this around? And instead of looking at this in terms of the cost of a death, we look at this in terms of the saving from a death averted through physical activity. So we flipped from a bottom-up approach that was looking at adding up things like heart disease and diabetes benefits to just saying, okay, we've got the Anderson paper, let's look at benefits in terms of all-cause mortality. And I was talking to Nick about this last week, and we'd been working on this, and then we had a coffee break, and I said to Nick, I'm not going to go on a coffee break, could you get me a cup of coffee, please? And we bashed something out, and what we bashed out ended up being something that looks, you won't be able to see the detail, but remarkably like this spreadsheet, which was a very, very, very simple tool in Excel that you'll hear the details of it from others in a minute. But the fundamental point was that we said, if the volume, or if a city or any area increases its volume of cycling by a certain amount, we can just look at the reduction in deaths that will arise from that through that regular physical activity over the long term. We can see how many people's lives, people who would have died because of all-cause mortality, which was the figure we had from the Anderson paper, how many of those deaths will not occur, what's the value of a statistical life, and you just multiply one by the other. Very, very simple tool, based on a whole load of assumptions, but we were very open about the uncertainties within it. And because of the uncertainties, we were also very clear that any assumptions that we made should be conservative assumptions. We shouldn't be over-claiming these benefits. And in fact, even without benefits being claimed to the maximum, going for the minimal figure for all of them, we still ended up with extraordinarily high positive economic value from activities, interventions that led to increases in regular cycling. That's my bit of it done, and I'll hand back to you now, Sonja.
Thank you very much, Harry, for this overview of how it all began, even which meeting room in. I'm very happy now to hand over to a key person in this whole development story, Robert Thaler from the Ministry of Agriculture, Forestry, Environment and Water Management in Austria, who without whom none of this would exist, I suppose. And we're going to hear a little bit about the government use of heat in Austria. Robert, thank you.
Thank you. Thank you, Sonja. Good to see you. And all those nice guys and ladies behind this heat. It's really a hot issue, so to say. I mean, I have prepared some slides. Maybe you can share them. But before I start the slides, I would say the first idea came in preparing the 99 conference in London, because this was the time when we started the 3 countries, afterwards a famous 3 country studies, calculating for the first time the health costs of air pollution, particle matter at that time. France, Austria, and Switzerland was not an easy task, but finally it was the key message in London. So, and after that we made the 6 country studies with Malta and the Netherlands, and other countries joined in. And at that time, the thinking in our brains started that we should not always talk about costs, but we should talk also about benefits. And in the PEP, which then was established, the benefits of health promoting or mobility was one issue. Because this year for transport guys, it was normally they always defending the transport system against the health and environment people, because always the negative aspects are in the forefront, but in the respect of active mobility, the positive stories were able to be communicated even by transport people. So it's positive to promote active mobility. And that was one of the background ideas when we started to think on something which makes it easy accessible to decision makers, easy to calculate, even it's has to be based not on a national study, we decided, but we should collect the most available and best practice and state of the art internationally. And this was the idea why we approached or joined our forces, WHO and some countries, and financed, so to say, the beginning of heat. And I think looking back, it was a good investment with high risk, of course, but you know, governments are always in favor of taking high risks. So it was not easy to convince all the involved parties, but at that time we had a very promising and a very good story to tell, because we want to calculate the benefits of mobility. So this, I think, was quite a good starting point. And we said, no, we don't want to calculate this on a national basis. We wait till we have an international, easy, accessible tool. And therefore, we put a lot of not only money, but also in-kind contribution through Austrian experts into this process. And we're very, very satisfied with what was the outcome. So thanks to all those which have been involved in that, especially thanks to Francesca, because she's one of the mothers of the heat, and of course also to Harry and Nick and all those involved, and also our Austrian colleagues involved, Max Heri and those, you all well know that. So now, what we have done since that, from the ministry perspective. Okay, we got this fantastic tool, easy to calculate. We translated. That's the first slide. So first of all, we translated it to German because we want to distribute it to all the stakeholders. Maybe somebody can make the next slide. I don't know, is this Sonja doing that?
I think it's Giovanna.
Or Giovanna? So, next slide, please. So this was the first approach. Then we said, okay, we translated the manual. We make a CD at that time. And then we made a big dissemination to all the municipalities in Austria. So to spread this idea, you have now the chance in an easy Excel sheet to calculate what amount of savings you can achieve if you increase your cycling share by 1% or by 10%. But just need somebody who takes the slides, Somebody can do it? Ah, yes. Nino. No, that's the first slide. That's the last one.
Which slide do you need, Robert?
That is the first or the second after the cover title.
Okay.
Yeah. So the translation was a very important step. And then what the question was, we translated it. You see this nice brochure with the X.
And can you go to presentation mode, Nino? So it's a bit larger. Sorry, Robert.
So this was the story we told to the stakeholder was, now you have a European, let's say, a European agreed tool how to calculate for the first time the health savings when you invest in cycling, in cycling at that time. And this was totally a new story because it's normally if you make cost-benefit analysis, you'll talk about time savings in millions or billions of seconds, which never appear in the system. But anyway, and then you calculate your classical infrastructure cost and make a ratio, and that's it. And for the first time, it was now benefits of mobility. So there was a quite positive resonance, and this was also one of the ideas why we said, okay, this is something which normally is for local people, but then we decided to change our approach and say, okay, if we want to push cycling or even walking, then you have to push it also on the national level. And despite the competence subsidiarity issues, we decided, no, the ministry will launch a master plan on cycling. And within this calculation or within the elaboration of this master plan, we for the first time applied the heat tool in a broader sense. So we calculated the effects of the implementation of such a master plan. If we would achieve a doubling of the cycling share, what does that mean? And for that, we used the heat tool, and that was also an important step to use it in a broader sense. So we calculated around 750 million euro. And if we double the cycling share as the target of this master plan, we would end up with savings of 1.4 billion euro. So this was an important figure because this is something which then you are in competition with motorway construction sums and railway construction sums, we thought. But then we had talks to our finance ministry and say, okay, this is funny and nice, but it's not in our classical budgeting, not relevant for our budgeting. We talked to the health sector. There was a big reluctance, I have to say, on these figures. But anyway, we didn't give up and we communicated. So it's becoming more and more. They become more and more familiar with this approach that you have health, you can calculate health benefits. Then we tried then also to put this into the walking strategy. That was the time when we decided on your level to extend the scope from cycling to walking. Then you know all the discussion. The criticism was accidents, air pollution. You have to counter we have to take into account these counterproductive effects. This was solved, so I think there's now a broad acceptance. What we now, the next step, what we did now, just recently, is we had started a big funding project on infrastructure for active mobility. And if you try to make the validation and the cost-benefit analysis in these for these projects and the calculate what amount of public funding is will be tailor-made for that, you need indicators. One indicator, of course, is the saving of greenhouse gas emissions, but you know, for cycling and for walking, you have short trips, so you have compared to other measures relatively low reduction rates of greenhouse gases, despite the fact you need, of course, this zero-emission mobility. And then for the first time we thought, okay, yes, but we have this heat tool. Why not think about to use it also for the calculation of the funding applications? And so we decided to do so. And so for each of these projects on cycling investments and even also on walking investments, they have to calculate not only the CO2 savings, but also the health cost savings. And this is then applied as one of the big indicators for deciding on how the public money is divided to the projects. So it's now a very important tool, so to say, to get public money from the ministry for investments in cycling infrastructure, especially in so-called cycling highways. And we see that the benefit of health is much, much higher than the benefit, for example, for reducing greenhouse gas emissions for active mobility. And it's a very decisive in the debate of a climate action policy that you are not getting, so to say, on the getting aside, because you see it's much easier or much better to make electromobility, because here you can calculate easily the savings if you change the vehicle fleet. But for cycling and walking and short trips, there is not a real big issue. But for health benefits, it's an important issue. So this, I think, is a very important application to use the heat tool. Finally, we can recommend it. I think the lessons learned is it has proven to be a very effective tool. So from our side, we can recommend it, the application to other member states or to other cities or regions. It's an easy tool to calculate, and but it's a serious tool. But it's also important to say it's not just an extra tool which is designed by somebody. No, it's based on the best available scientific knowledge in Europe, and we hope that the success story of heat will not end now, but even go further, and look forward also to support further steps on improving it or making it even more sophisticated than it's already now. So I think we can say from the Austrian side, yes, please use it.
Thank you very much, Robert. Apologies that we couldn't show all the slides. Maybe they can also be shared to participants later, but I think a very nice storytelling of these experiences anyway. And with that, handing over to Nick Cavill, who's been one of our most crucial advocates, who's going to tell us about 10 years and the growth over time.
Okay, so it'll be much better in a presentation because there's a build-up slide, but no, never mind. So a great start from early beginnings, a simple but evidence-based idea, and I'm just going to really quickly take you through whistle-stop tour of the next 10 years, what's happened. So if you could hopefully get to the second slide. As I think people have understood so far, this is very, very much a collaborative project. Okay, a small group of people may have been there at the birth of this idea, but very, very many people have been involved throughout the process from a very wide range of disciplines. If you can get to the second slide, you'll see a massive list of names that shows people are from a big range of backgrounds, epidemiology and public health. We've brought on people involved in environmental science, air pollution, health economics, of course, right from the beginning. That's a key part of the expertise needed. Transport economics, transport planners, policymakers in terms of understanding how the heat may be applied, and people involved in practice and advocacy.
I apologize. Do you see the second slide? Because I can see it.
No.
Unfortunately. So if I do like this.
Yeah, slide 3, please. If you're, yeah, that's good. Great, thank you. Because this is the main point of what I'm wanting to say, really, is how the that's much better, thanks. How the heat has grown over time. So Harry talked about a very basic spreadsheet just about cycling right from the start before 2011 that was downloadable from the heat website and was a tool, was useful for people and was a good start. But the real launch came in 2011 when we combined cycling and walking and provided an online version that really was the start of this whole process. An online tool, so you didn't have to download a spreadsheet, relatively simple calculations, as Harry said, using the epidemiology to inform health economics, basically, and not really many adjustments. So lots of expert judgments had to go behind the scenes to develop the tool, and lots of evidence was used to populate the sort of core values, but the user couldn't really adjust very many things. And some of the feedback said, well, we'd like to be able to apply things more specifically to our situation. So in 2014, quite a major revision, again, an online version so that people could access this easily from anywhere, with some, again, very much based on emerging evidence, updating the relative risk figures and the value of statistical life figures to make sure that the tool was based on the best available evidence. And also country-specific values of statistical life, because that's clearly a very important aspect that feeds into the sorts of values that people are able to create. 2017, really very much a major revision, led by Thomas Gotchi and others, using much more accessible code and making the tool much more able to be adjusted and adapted as it went along. A new user interface, so a different way for the user to find their way through the tool. And we combined walking and cycling. So in the 2014 module, if you had a shared use path, you had to run through the tool twice. And with the 2017 model, you didn't. Walking and cycling were combined. And then, as has already been mentioned, particularly by Robert, in 2017, we began to address some of the potential, you might say, criticisms of the tool. People would say, well, it's all very well to value the benefits of cycling and walking, but let's think about the additional exposure that cyclists and walkers have to pollution, to being killed or injured through a crash, and additional considerations about carbon. So if we are able to encourage people to switch from cars to walking and cycling, what's the carbon saving and how could we value that? So that was quite a major sort of methodological change. And then in 2021, really the big change is not so much about the actual science of the tool, but the fact that WHO is helping the heat to expand beyond Europe and to go global, so having a global version of the tool. Lots of additional changes, though, lots of new ways for countries to have specific inputs, new data input options if background data is missing. So lots of assumptions and default values, but if people have the data and evidence and willingness to sort of override those and put in their own data, they can do so much more easily. So if we can go to the next slide, please. I think I'll look at this one and then we'll skip slide 5 because that goes into enormous detail. Really, the basis of the tool now is we still rest on the clear sort of guidance or principle that we want the user to have an easy experience and to be able to put in as few, or be required to put in as few data inputs as possible. So there are only 2 major data input values that are needed, but lots of adaptations for people who have the data and want to have a more sort of sophisticated calculation. But essentially, the user is asked what they want to assess, whether it is walking or cycling, given the opportunity to put in data on the number of people walking or cycling and an estimate of that volume of walking or cycling, able to adjust those data inputs for certain parameters, and then the tool does the rest, calculates the benefits. And as you can see now, we're able to say the key main benefit is still the physical activity benefit. So the reduction in all-cause mortality is a result of the increased physical activity. And then additional calculations are added on to say, how is that affected by increased exposure to air pollution, crash risk, and if some of those people change from walking and cycling, from car travel to walking and cycling, what's the carbon saving? And then we put a value on that carbon. And so we're able to say at the end, what are the impacts on mortality, and related back to Harry's initial point, by using value of a statistical life, monetize that and provide the user with an overall cost or value of that increased walking or cycling. So if we could jump to slide 6, please, I'll finish. It's difficult for us to, over the years, the web statistics have changed a little bit, and particularly when we went online. But we can say that we've had a very good, very high level of visits to the website, 980,000 times since 2011, 62,000 unique visitors. And we've seen applications from across the world, even though the initial heat was supposed to be Europe only. Many people have applied it across the world, and has been used in quite a variety of different case studies and academic papers and so on. So we've been happy to see how the heat has rolled out, how it's developed so much from an initial idea, and how now we're able to take on board, additional benefits of walking and cycling, pay regard to any additional risks, and to make sure that those are presented in an overall strong evidence-based package. Final slide, please, just to say that, as I'm sure you realise, loads and loads more information available online on the website to get into these issues in a lot more depth. But I just wanted to give you a quick introduction and an overview of what we've been doing for 10 years. Thank you.
Thank you very much. I'm glad that we could bring up the slides in the end. I've turned off my camera because my bandwidth is slightly limited, so my audio is a lot better this way. I am happy to introduce Ms. Lucy Saunders, Director at Health Streats in the UK.
Okay, so the opportunity in 2012, if we go to the next slide, was that there was political leadership who were very enthusiastic about building cycle infrastructure. The Mayor of London at that time was Boris Johnson, who you can see in this image here, on a piece of cycle infrastructure that was eventually built as a result, in part, of the use of the heat tool in the business case. So back in 2012, the Mayor really wanted to build cycle infrastructure. He was a strong advocate, but there was a challenge. So if we move on to the next slide. If we move on, the challenge that was being faced is one that was being faced all around the world, which is that decision makers are meant to be looking, when they're making decisions about what projects to fund, at 5 different aspects of the business case. So slide 5. And they're set out here. These 5 cases should each be considered and given important consideration. The issue, if we move on to the next slide, came from an over-focus, an over-emphasis on the financial case. The financial case is where the benefit-cost ratio is calculated and presented, and there was a tendency for decision makers to flip straight to the financial case and look at the benefit-cost ratio. This would not be a problem if the benefit-cost ratio was always putting a monetary value on things that were of importance strategically. But most benefits that are being calculated and most costs that have been calculated at that time assumed that the strategic case was an increase in car use. So if you moved more cars through, if you increase if you increase traffic speed, then you got a good BCR. And if you did the opposite, maybe by reallocating some space away from cars to make space for a cycle lane, then you got a very big negative impact in your benefit cost ratio. So the issue was the calculations in the financial case were not aligned with the strategic case in cities like London, where there was a real appetite to be building more cycle infrastructure, improving conditions for people walking and cycling. And this meant that the projects that were getting the green light were not aligned with strategy. They were projects that were maintaining or increasing capacity for motorised vehicles. So we needed to do some things, and I took two prongs to my approach. The first was a short-term response. So if we skip to slide 8. My first approach, my short-term response, was to deliver fun training, and fun is an important word in this. People only came voluntarily. They wouldn't come and they wouldn't tell their friends to come. So I delivered fun training to project sponsors on how to monetize the health benefits and why they should care, to try and get them enthusiastic about doing this. And I created this document that you can find online, Valuing the Health Benefits of Transport Schemes, which was a translation of the HEAT tool into the local context. So it made it easy for project sponsors to use the HEAT tool in their business cases. And then the second aspect of this short-term response, if we go to the next slide, was to show decision makers the value of monetised benefits. And so what I did here was I used the HEAT tool on a number of case study projects in London and put them in a very glossy coffee table book called Better Streets Delivered 2, which you can also find online, where a number of these projects I calculated the monetised health benefits to show people that us making conditions better for walking and cycling because it delivered this economic gain. So if we move on, the next slide is talking about the longer term transformation that was needed. So the next thing we needed to do, if we move to slide 11, was rebalance the decision making, build the emphasis on the strategic case, reduce the overemphasis on the financial case, and really look at, are we building things that are achieving what we want to achieve? So if we move on to the next slide, I developed something called the Healthy Streets approach, and I then worked to implement it in London. The Healthy Streets approach is based on these 10 healthy streets indicators in this colourful circle diagram. And this is an attempt to reframe decision making around streets on people and what people need out of streets, of really introducing public into the transport world. And this was initially adopted under the mayoralty of Boris Johnson, but when Sadiq Khan became mayor, he put it right at the centre of the strategic approach with this document on the right called Healthy Streets for London. So then public health became the goal of the organisation at Transport for London. If we move on to the next slide. I went to each of the different sectors to get them on board with the Healthy Streets approach. And you might think, why does this matter? As long as the transport sector are focused on delivering these health benefits, then it's a win for us. But actually transport have quite a limited role in streets and in walking and cycling. And it's important that the people involved in spatial planning and environment policy and policing and building new homes are also all pulling in the same direction and doing things like using the HEAT tool in their decision making. If we go on to slide 14, just focusing in now on Transport for London, they had a very standard funding structure that you see all over the world in transport organisations, where the pot of money is divided up into lots of little bags that are spent by different teams on different projects. And the challenge with this is that it's quite easy to get the team whose bag of money is called active travel to use the HEAT tool. But if we want to deliver really big public health gains, we need all the people managing all the bags of money to be thinking about using the HEAT tool. And so if we move on to the next slide, one of the biggest and most important changes that happened in London was that all of these pots of money were put together into one big pot of money that was called the Healthy Streets Fund. And that meant that the board who decided how this big pot of money was spent understood that that money needed to be spent in a way that delivered the 10 Healthy Streets indicators and therefore public health gains. And it was easy for them to look at a business case, not just looking at the BCR, but making sure the BCR included the heat calculation and making sure it was aligned with the Healthy Streets approach. So making it easier for people to walk and cycle. Slide 16. I also developed this tool for the designers to show them how to design a street so that it would get a good outcome using the heat tool. So the designers want to deliver a project that's going to get a green light, and this tool, the Healthy Streets Check for Designers, helped them to see what they needed to do in the design process to deliver a street in which people would choose to walk and cycle, and therefore the heat tool would give a good result. But more importantly, that would deliver a big public health gain in terms of people being physically active. Slide 17. Coming to the end now, I would say the situation that London is in now is very different to when I started in 2012. Today, it's actually hard to not build good streets for walking and cycling in London. So what was started by the Mayor of London, Boris Johnson, has been carried on by the current Mayor, Sadiq Khan, who's just been re-elected at the weekend, and his Deputy Mayor for Transport, Heidi Alexander, who's the woman on the right. So we have a Prime Minister, a Mayor and a Deputy Mayor who have really taken a lot of leadership in making sure that the default setting now is that you build good streets for walking and cycling rather than having to make the argument on a case-by-case basis. And that's it from me. Thank you.
Thank you very much, Lucy. I really like that. It's really hard not to build good infrastructure for walking and cycling. How far have we come? That was quite different than 10 years ago. Thanks to your work, and maybe also a little bit thanks to you in terms of explaining benefits from doing so. Excellent. Thanks for that case study. Lucy, I'm handing over to Professor Kanerva-Lehto Heli from Turku University.
Yeah, I will tell a few words about our project that just have ended, and the whole name for the project is the Participatory Urban Planning for Healthier Urban Communities. And in our project, there was altogether 7 organizations around the northern Baltic Sea, and the finance came from Central Baltic Program from EU. And shortly about our project objectives and concerning heat tool, one of the objectives was to help the project cities to make heat tool calculation for cycling, not for walking, and with the help of the experts we have also here in this webinar. And we had quite structured trainings, and firstly we had introductory trainings, and we had Cavill and Pekka, as you most maybe know, also Pekka, and also some experts from VSP Finland. Kanerva-Lehto was with us in these introductory lectures, and we all got quite good view about the background and basics about the heat tool. And after that, we had local workshops, and they were kept face-to-face, and we had again Hannu-Lehto and Kaisuliina Vihanti with us, and most of the time was reserved for the personal guidance, and we just were sitting with our computers and look at the different values and what difference does it make when we change the values, and what kind of results we will get then. And also in the Tartu city workshop, there was some stakeholders with them, and they also get good information about the use of the tool. And after the actual training, there was a data gathering phase, and after that also the online tutoring and discussions via Skype, so that everything went as it was meant to be. And also Hannu-Lehto helped with the interpretations, the cities in this project. And I think this is the main issue here, that how we spread our information and experiences on use of heat tool. And we had a lot of seminars and workshops, and each city and region in the project had a seminar for regional stakeholders and like municipal and regional traffic planning authorities and consultants from different enterprises. And also the local and regional cycling NGOs were present in these seminars. And after this phase, we arranged a series of webinars for all project countries, and at least in Finland and in Sweden, we managed to get the national authorities and traffic planning consultants to our webinars. And also in one webinar, Lucy Saunders was telling us about the healthy streets and how she managed with also the monetized things, as we just heard. Together with these webinars, we had some communicational actions in Facebook and in LinkedIn, and I think these helped a lot. At least in Finland and in Sweden, we had certain Facebook groups, and we could share our information about these webinars through these Facebook groups. And when the project became to this end, we made this handbook for participatory urban planning, and we have gathered there our experiences in the project, and we have there few pages about heat tool and our calculations and the results, as you maybe see something in the lower picture. And the handbook is in the project website, and it can be used freely, and there's also some videos and infographics that can be used if you go there and look at them and find them useful for your purposes. And then a few words about our case Stockholm. I think this was the best achievement we had in our project, and most of the glory goes to Cykelfrämjandet, which is Swedish Cycling Advocacy Association, and they were really active in the Stockholm area and active towards the press and other internet media they have there. And the purpose was to make just one seminar for the regional and city of Stockholm's traffic planners, but there was so much interest on these calculations that they have to organize for a series of workshops for them. And there was also a separate workshops where our project people look at the heat tool with the regional and municipal traffic planners. So they looked at the heat tool and the basis of it and the calculation phases and also the data gathering for the calculation. And also there was a present National Transport Administration people and some Stockholm's bicycle office people. And also they had interest to try and to use heat in their future projects. I tried to ask the Stockholm bicycle office what is the situation just right now, but the person working there was on a vacation, so I don't have now the exact situation about the use of heat tool in city of Stockholm and Stockholm region. And here also some clips about the newspapers and internet papers they have. So I think here in Turku, where I'm from, we didn't get our results through the or to the newspapers, but in Stockholm they had at least 3 news in the newspapers, and one of them is nationwide. Yes, and finally some conclusions we had, and once again I want to highlight this Stockholm case because we had so good results in there, and Cykelfrämjandet managed to rise the interest of the traffic planners in the area, and they were really active in all actions they had, and they used different possibilities like cycling days and things like that to get their message through the larger persons and media. And what comes to our webinars, at least in Finland and in Sweden, we got these national traffic authorities and nationwide consultant offices and their expert to the webinars, and also national NGOs like Cycling Federation of Finland and some others, and the Facebook group and some groups and some email lists were helpful with this along our personal contacts. And when we were doing these, we noticed that maybe it would be interesting to make some wider survey about the effectiveness of heat calculation use in decision making and how they realize in infrastructure investment in cycling, and what it takes for city urban planning and the cycling advocacy that NGOs are working here and in Finland and Estonia and Latvia also. But here was my slides, and thank you that I get the possibility to.
Many thanks, Sonja, and many thanks to all the speakers who have been with us this afternoon. Perhaps we can turn quickly to the question and answers panel, because there have been several interactions going on there. And I would like to take the last 5 minutes or so this afternoon to look at them. And I must say that, you know, having been in this business for a long time, I like to see that many of these questions are part of our wish list. and actually, it is a great prompt to continue our work. So I've seen that most of these questions have started being addressed, but the first one is about whether we can use the tool also for companies. And I see that the reply is a big yes, because in fact this is one of the typical uses that we recommend. What you need is a population, so it can be a population of workers within a company, and then you can make an assessment of how this is going to change in terms of health benefits for this population, because they will increase their cycling or walking. Of course, we have always to be reminded that the heat to maximize its usability and uptake, also in settings where you don't have a specialistic capacity to look into you know, morbidity, more sophisticated analysis. We have always concentrated on mortality. So this is the key benefit that you would get by using the heat, the quantification of changes in mortality risks. We are working, and this is another of the questions here in the panel, to add some additional functionalities to the tool. For example, morbidities. We have been dreaming of having morbidities there now for several years. And also if we could have a heat for children, for young people. It's on the radar, but we still need to sort out some important methodological aspects, because again, within the heat, we are not just producing a tool for health impact assessment. There are very sophisticated models that can do that. Something that is at the core of the heat is to make it user-friendly. And if you paid attention to what Nick presented, you will see that something to which we are tremendously attached is that people should be able to use the tool in principle in its basic version with only 2 numbers as an input. and keeping as loyal as possible to this principle of user friendliness. I can tell you it's a hard job to find the right approach from a methodological point of view. And as Harry was saying, perhaps we need another good symposium and another couple of good dinners together to find a smart way that we flip the coin and we say, yeah, this is the way to go about that. I've seen also questions about the social categories. Well, I think the answer I've just provided helps you to understand why we are not yet able to look into this differentiation, unless we are able to relate this to big population groups. For example, if we know that there are significant differences in, I don't know, level of income or affluence between different cities, but then this becomes, introduces some additional need for assumptions. So for the time being, we focus, as I said, squarely on effects on mortality. I think that the other question, which is at the core of our hopes, is when we will be able to develop a module for e-biking. We know there is a huge need and a huge appetite for that, because electric mobility and electric micromobility in particular are booming across the world. So we are all very much eager to be able to develop a new module of the HIT, a new functionality of the HIT that we can use and apply to e-biking. So I can only say watch this space, because we are very committed to continue mobilizing the resources. I mean, the HIT has been developed over a very long period of time, thanks to investments of some visionary donors. You heard from Robert at the beginning. Natural England was was very prominent for us to enable the walking part of it. The European Commission has been a very important partner for us for some of the developments. But as you can see, nothing has happened without a robust effort of resource mobilization. So we are committed to continue to do that. If you have good leads, a good suggestion for us, let us know, because this line is always open for good ideas, good inputs, and the enthusiasm of the team is there, and we are expanding the team to make it global. So we are looking very much forward to continue the journey with you. Your participation in the virtual space is a strong encouragement for us. It means there is a world out there that is using the tool, would like to use it more, would like to use it differently, and we hope to be with you in the months and the years to come to see and to celebrate not only a child that is becoming a teenager, but we want to take it into adulthood. So we are now like proud parents of the HIT, uncles, aunts, grandparents, grandmothers, friends, and we hope that you will join this family on this really unique enterprise that we have set together, bringing together science, policy, and the people. And I hope you will be part of the journey with us. Thanks, everybody, and see you very soon. And see you on Monday at the high-level meeting. We want to see the master plan adopted. Bye-bye.
Thanks very much, everyone. Thank you.